receiving a cancer diagnosis and then seeking treatments for those therapies can be really difficult on families. And that's why the team of doctors here at the UF Health Proton Therapy Institute are making it their mission to make it really easy on patients while making it tough on cancer. So today we are lucky enough to have with us one of the physicians here, Dr. Danny Ndelicato. Did I say that right?
That's correct.
Perfect. Okay, well, thank you so much for joining us. We're glad to have you here today.
You're welcome.
Well, let's go right into, we were talking earlier about some of your younger patients and something that they are suffering from, and it's called, and I may let you say it, ependymoma?
It's an ependymoma.
Ependymoma. Tell
Correct.
us what that is.
It's a pediatric brain tumor that occurs in any age, really, but we see it most commonly in children 7 and under. And it can arise in the top part of the brain, the back of the brain, or the spinal cord.
And so here at UF, I think you guys did a study on that, right?
We did.
Tell us more about that study.
The study was unique in that it collected patients from all over the state of Florida, all over the country, really all over the world. Children with this unique and relatively rare brain tumor called ependymoma. In bringing those patients together, we were able to create the largest single institution series of children and treat them with proton therapy, and then use the resources of the University of Florida to study the outcomes, learn about which children did well and which children didn't, and understand better the disease process, but also the impact of radiation from a short-term and long-term standpoint in their recovery.
Well, let's go into that, because I think whenever you think of cancer and being diagnosed with cancer, you do think just immediate, your mind goes to radiation therapy. What's the difference between, because we do hear about proton therapy, but I'm not sure I really know what it is. So proton therapy maybe versus the radiation typical therapy.
Sure. Proton therapy is a type of radiation. And radiation overall is used to get rid of tumor cells that you can't take out through an operation or chemotherapy. The difference with proton radiation is that we have a little bit better ability to control where it goes and where it doesn't go. More precision. And that's important for anybody at any age who's being treated for cancer. But it's particularly important for children, and particularly important for children with brain tumors, because these tumors, these cancers, are located nearby so many important organs.
So you're really trying to save the surrounding areas and just zone in on that one area? Is that what you're doing?
Exactly. Avoid things like the developing brain tissue, or the nerves that control vision or hearing, or pituitary gland, which produces hormones that do things all over their body that are so important as they move on through puberty and adulthood.
Yeah, because especially they're still growing.
Exactly.
Yeah, that's tough. Okay, and so what makes the study so unique? Because I know it's unique in many aspects.
It's unique because we treated all these patients with proton therapy, but it sheds light not just on the technology of protons and the unique aspects associated with the delivery of proton therapy, but it's information that we can apply to children treated with radiation of any type for ependymoma. So it's really applicable throughout our whole field.
And so is it the same protocol for children versus adults, or is that different?
The protocols for children are aggressive. And they're particularly aggressive considering how many years these children have to live with their potential side effects. So if you cure a child who's 6 years old, yet they lose hearing, all those important milestones in development and throughout their life, you have to manage. And that's the difference between treating a 6-year-old and an 86-year-old.
So what if someone is unfortunately at home thinking about looking into this type of therapy, looking and maybe wanting to go to UF Health and want to get another answer, maybe possibly look into some kind of ongoing trial? Mm-hmm. Where can they find that information?
There are many points of entry. The first is the internet. You can find us at floridaproton.org, but also you can just call the clinic any day and you'll be connected to one of our pediatric nurses who will immediately be able to discuss the case and the relative use of proton therapy compared to conventional radiation.
Well, Dr. Indelicato, we thank you for your time and definitely for all that you do for our youth and for our adults. We appreciate you.
Thank you.
So thank you very much. Thanks for joining us today. And special thanks to UF Health Proton Therapy Institute for providing this information. And if you want to learn more, all you have to do is go to their website, which is floridaproton.org.